1. Visually check packaging integrity. Product is sterile. Do not use if package is damaged or open. 2. Using aseptic technique, open the set from the sterile packaging. 3. Close vented cap on the spike. 4. Verify RondelO handle is in a flushing position. 5. Close the roller clamp. 6. Remove protective covering from spike tip. Note, take special attention that the exposed end of the spike will not come into contact with anything, otherwise it can be contaminated. 7. Spike the container. 8. Fill the drip chamber until 2/3 with squeeze and release technique. 9. Open the roller clamp and prime the tubing line to evacuate all air per hospital policy. 10. Close roller clamp. 11. Disinfect the needle-free valves of the drug inlet to be primed, connect a syringe and select the drug inlet with the RondelO handle, and aspirate any air out. Repeat for all drug inlets, or turn the RondelO handle into the drug inlet to be primed and unscrew female lure lock cap gently and let air escape out through each drug inlet. Repeat for all drug inlets. If not all air is removed from the tubing, air may be forced into the patient's vascular system and may cause air embolism. 12. Remove the prime stop cap and connect the primary IV set to the patient's catheter via lure lock per hospital policy. Note, check for fluid leakage before and during the procedure. Leaks can result in the loss of sterility, fluid, and/or air embolism. If a product leaks before or during use, re-tighten the leaking connection or replace the product. Connect secondary IV set to RondelO and back prime. 1. Close the roller clamp on the primary IV set. 2. Verify the clamp on the secondary IV set is closed. 3. Verify the RondelO handle is not aligned to the drug inlet to be connected. 4. Disinfect the needle-free valve or remove the female lure lock cap from the RondelO drug inlet to be used per hospital policy. 5. Remove the cap from the secondary IV set and connect to the RondelO drug inlet to be used. 6. Select with the RondelO handle the drug inlet to be used. 7. Lower the secondary bag to a level below the primary bag, open the clamp on the secondary IV set, and let primary fluid back prime the secondary IV set. 8. Stop the back priming when the drip chamber on the secondary IV set is half full by raising the secondary bag to a level above the primary bag and close the clamp on the secondary IV set. Multiple secondary IV set can be connected at the same time, then repeat procedure for each. Administration of a selected drug with automatic flushing takeover from the primary bag. One, place or verify that the primary bag is placed on an extension hook to a level below the secondary bag to be administered. 2. Select with the RondelO handle the drug inlet to be used. 3. Open the clamp fully on the secondary IV set to be used. 4. Adjust the roller clamp on the primary IV set to set the flow rate of the secondary IV set. 5. Verify the drip chamber of the primary IV set has stopped and that the drip chamber of the secondary IV set to be used is dripping. If there is dripping in the primary IV set drip chamber, then adjust the height by lowering the primary bag further to ensure enough head height difference between the secondary and the primary bag. 6. Flushing fluid from the primary bag will automatically flush the primary IV set after the secondary IV set has stopped. Flushing in between drug administrations using a dedicated flushing position. 1. Position the RondelO handle into the adjacent flushing position located in between the drug inlets. Flushing fluid separates the drugs in the IV set and rinse RondelO internally. To give a subsequent drug. 1. Select with the RondelO handle the drug inlet to be used. 2. Open the clamp fully on the secondary IV set to be used. 3. Adjust the roller clamp on the primary IV set to set the flow rate of the secondary IV set. Disconnection from a drug inlet. 1. Verify the handle is not aligned with the drug inlet to be disconnected. 2. Verify the clamp on the secondary IV set is closed before being disconnected. 3. Recap the drug inlet of RondelO. For hazardous waste, avoid unnecessary disconnections. Disconnect of the primary IV set from patient. 1. Close the roller clamp on the primary IV set. 2. Disconnect per hospital policy. For hazardous waste, let everything be connected to RondelO Primary IV set and discard as a whole from patient.